Ovarian cancer. Today we will be discussing about the causes, the symptoms and the management of ovarian cancer. Ovarian cancer is the cancer of the ovaries. Every female is usually born with two ovaries and a cancer may develop in these ovaries. So ovarian cancer, what are the symptoms of ovarian cancer? How you can know that you may be suffering from ovarian cancer? Ovarian cancer in the early stages is usually asymptomatic. It may be an accidental finding on sonography. Otherwise, ovarian cancer may give a lot much of symptoms like, in advanced stages specifically, like it may give you abdominal pain, a bloated up sensation, early satiety, that means you eat a small quantity of food but you feel that your belly is full. You may have a problem of frequent urination. It may give you pelvic pressure, constipation, weight loss. Sometimes it may give you an abdominal lump also. It may present as menstrual irregularity, that means either heavy bleeding or bleeding in between the periods. So these are the usual symptoms of ovarian cancer, but mind it, ovarian cancer in early stages may be asymptomatic. In advanced stages, definitely it gives all these symptoms, but in early cases, it is usually asymptomatic and usually it is picked up on an accidental sonography done for either some other purpose or one of these reasons. So, coming to the risk factors or the causes of ovarian cancer, why it develops. So, the most important cause is definitely your genetics. If you have a family history, if your genes are like that the risk is high, then definitely the chances of getting ovarian cancer will be higher. If you have heard of BRCA genes, then definitely these are the genes which may give you ovarian cancer. If you have a family history of ovarian cancer, breast cancer, uterine cancer or a colon cancer, then the possibility of getting this ovarian cancer is relatively higher in your case. If you are obese, the weight of the body is on a higher side, then also the risk is higher. If your menstrual age has remained long, that means you have menstruated for a longer duration of time, that means you have an early menarche and late menopause, then again the chances of developing ovarian cancer is higher. Fertility inducing drugs also in long run may give you ovarian cancer. Nulli gravida, that means you have not given birth to any child. This thing also increases the possibility of getting an ovarian cancer. A hormonal disease, that is endometriosis, also increases the risk of ovarian cancer. So, coming to the diagnosis of ovarian cancer, how we come to know or how we diagnose an ovarian cancer. If patient is symptomatic, we may do a PV examination, we do clinical examination in which we can feel the lump. We go for investigation modalities like sonography, MRI scan or a CT scan. All these things are helpful in knowing about the lump, in knowing about the ovarian cancer. The blood test which is usually recommended for ovarian cancer is CA-125. Ovarian cancer is usually seen in 50s and 60s. So increasing age in itself is also a risk factor, although sometimes rarely in young ages we may also see a specific type of ovarian cancer which is a germ cell tumor. Basically ovarian cancers are of three types: epithelial cell tumors, stromal tumors or germ cell tumors. So germ cell tumor, this particular group of tumor is more common in a younger age group. Regarding the treatment part, it is usually surgery. The surgical removal of ovary is usually done along with fallopian tubes and uterus if you have ovarian cancer. Plus minus chemotherapy, that means sometimes chemotherapy is needed and sometimes if it's a very early stage then it may be omitted as well. In most of the cases we do need chemotherapy as well. So how can we prevent ovarian cancer? The things which you can do or the things which are protective for ovarian cancer are, first and very important is oral contraceptive pills. Birth control pills or oral contraceptive pills are protective against ovarian cancer. Maintaining a healthy lifestyle, that means taking less of fat in your diet, maintaining an ideal body weight is also helpful in preventing ovarian cancer. Pregnancy and breastfeeding is also protective against ovarian cancer. As compared to ovarian cancer, ovarian cysts are relatively far more common. Ovarian cysts are usually non-cancers. Rarely a few variety of them may be cancers. So if you are suffering from ovarian cyst, you need not too much worry for them, but definitely need to keep a watch on it, need to have a close monitoring, close follow. If you have any confusion regarding ovarian cancer, you can write us down in the comment box section. Thank you.